Okay. Can you hear me over there, guys?
Yeah.
I can hear you.
You good over there, Brian?
Yeah, I'm good.
Mike? Good. Okay. So today we have a special guest. This is one of my closest friends from residency, Dr. Brian Phillip, who's a board-certified anesthesiologist. He's also a personal trainer, a fitness guru, a martial arts specialist, fifth degree black belt, right? And a whole bunch of other stuff. But Brian, just go ahead. Why don't you know what? That's a whole list. Why don't you just go ahead and tell us a little bit about yourself?
So I grew up in Brooklyn. Me and Ram went to residency together. I spent my whole life being a little bit of that obese kid, always chasing after peanut butter and jelly sandwiches. And then afterwards, I decided at one point in my life that I needed to make some sort of difference. Like I got really skinny in high school. I ended up, graduating high school like at 110 pounds. And I think afterwards I said, you know what, I need to make a little bit of a difference. So I decided to go to the gym. And I also kind of needed to protect myself a little bit. So I decided to get involved in martial arts at an early age because I felt like I was going to get picked on a lot. And I went from 110 pounds to now I'm 215 pounds. So made, significant changes in my life to get to where I needed to be now through diet and exercise.
Very cool.
Can I ask a question real quick before we go any further? I just want to ask. So, what's the most common form of exercise do you do? Is it pretty much everything, or what do you like to focus on?
So I like to make a combination of sort of aerobic training, a lot of like high intensity interval training, a lot of strength training, and definitely flexibility. It's key in my role of just my regular daily regimen, pretty much like every day. You have to be flexible. Otherwise, once you have an injury, pretty much everything goes out the window.
Yeah, that's something I definitely ignore, and I shouldn't ignore. I have the least flexible hamstrings of any man on this planet. It's sad.
So Brian, let's just get to the meat and potatoes of our talk today. So one of the big questions, obviously, with a lot of the country opening up, I think a lot of states are in phase 1, some are in phase 2. Gyms are sort of, a lot of gyms are opening back up, whether the big, large gyms like Planet Fitness, LA Fitness, and then obviously your smaller private gyms and workout studios. Let's just, I guess, maybe break it down I'll break the question down into 2 segments. For people that want to go to those larger gyms, what are some of the recommendations or some of the concerns that they have that you might want to, address?
How do we get back to the gym after, enduring this, highly contagious pathogen? I believe we're going to have to adhere to very strict protocols. We're going to have to limit the amount of people in a facility. I mean, you can't have in a very tight space, hundreds of people. It's just not going to work. So even when you think about it, the 6 feet apart, everyone says you have to be 6 feet apart. Now we know the difference between us speaking very quietly versus whispering versus, a trainer like yelling and things of that nature. So is that 6 feet apart rule essentially really going to be working for us? Because, your breathing pattern changes very much so when you're training very intensely. So you're going to go from talking normally to breathing heavily to panting, and you're going to get those aerosols. If you are one of those individuals that are, affected by COVID, you're going to be spreading it further and further. So my question is that 6 feet apart really something that is going to be valid when you're working out and training hard and intensely in the gym? And then again, you also have to think about it. Should the trainers be wearing masks when they're training their clients? Because they're the type of individuals that will pretty much say to everyone, hey, got to work out harder. Come on, push, we got to go. As I'm talking right now, I'm like pushing that air even further and further. So now trainers are supposed to pretty much wear masks. I mean, I just kind of want to know what your thoughts also on that, that sort of thing is too.
Mike, you want to?
Yeah. So when this pandemic first started off in Wuhan, China, that was one of the first things that they shut down were the gyms. And then same thing in when the virus hit this country in New York. Actually, my apartment building in Long Island City. I'm in South Dakota now, but my apartment in Long Island City, the first thing in that apartment complex that they shut down was the gym. And it makes sense because for a couple of reasons. One, there's so much that we don't know about the virus, even at that, especially at that time. But also, that's where even before coronavirus, that's where germs spread, and we all know that. So whether that's flu or other coronaviruses or other rhinoviruses, that's where germs are spreading the most. So between people sweating and leaving their sweat there, then someone else touches that sweat, or whether it's inadvertent or what, they then touch their face. That's how things happen. And then, of course, with a respiratory virus, when someone is breathing deeply, we know that, it's going further when someone's breathing deeper or also when someone's sneezing. So you have to have, you know, minimal distance, I would say more so compared to everywhere else in the world. So the 6 feet is great in general, but when someone is huffing and puffing, I think you need to double that. There's no scientific proof of what I'm saying, but in my opinion, I think it'd be reasonable to double that distance just, to be safe. And that goes along with wearing masks as well. And that goes along with wiping down everything. Of course, no one wiped down everything before COVID. No one's going to wipe down everything post COVID. But I think you just have to be more cognizant of that. And I think people would be more cognizant of that. So everyone's saying, hey, can you wipe that down if they don't wipe it down? And just have rules. This is going to be new rules at the gym, and everyone has to abide by those rules. And you're not going to be able to fill gyms as much as you did before. But with all that said, you can still get back to the gym, I think, as long as you have all these rules in place and people abide by those rules.
So, just backing a little bit of what you said. Also depending on the size of the gym, ventilation is extremely important. Now, windows should be open, doors should be open. There should be maybe fans blowing air into one direction, leading outside to the windows, outside to the doors, because we can't just keep in sort of like this closed, contained area. Like you go to some of your spin classes, the doors are closed, everyone's jam packed right in the center of everything, and everyone's just going in. Now this is post, we're going back to the gym after this COVID pandemic. Now I think that has to change. We're gonna have to limit the amount of spin bikes in a room. In my gym, we currently have probably maybe 50 spin bikes in a room. Now we might have to limit that to 10 to 15. I think those are some of the things that we have to consider. In addition to cleaning, you have to clean your bike or your workout equipment before and after you've used it. And then someone else who's going on to that same machine either has to wait for it to dry and then clean it again, because they may not trust the protocols or sort of the measures that someone actually utilized to clean that same equipment. So there's like so many different things that go into the thinking about when you're reopening. Group training has to be a small amount of individuals. You might have to limit it to a smaller space, small amount of people. You might have to go outside. You might work out in the gym's parking lot around the area of the facility. And I think this is something that I think a lot of gyms are hopefully taking into consideration when they're thinking of reopening. And even just the trainers, I hope they're thinking about some of these things also.
But Brian, if you've got some gym or even some trainers that are not really concerned or maybe don't understand the severity of what coronavirus has done in our communities, would you recommend people bringing their own disinfectants and wipes? And if so, is there a particular brand or something you would recommend, or sometimes alcohol-based or?
Well, we've known from like the studies that coronavirus, in terms of inactivation of the virus in a minute, higher alcohol percentage, sodium hypochlorite, things of that nature, Clorox, some of these wipes. But there are people that have certain allergies to some of these products, and we might have to be very cognizant about utilizing some of those things. I think that people should start wearing, longer sleeve shirts, longer sleeve pants, instead of wearing the traditional, tight-fitting short crop top shirts and tops and things of that nature, because now we're going to be disinfecting everything, consistently and every time someone uses it. Some gyms, they're like, I know, 24-hour fitness, they're models that you have to sign in on an app, you have to schedule your appointment, and in between, on the hour, like every other hour, they're going to be spending that hour of downtime cleaning the gym. So, even looking at the gym as from the business aspect, it may not work out as well. A lot of these gyms will survive, and a lot of these gyms won't. These are a lot of things that they have to take into consideration. Even hiring staff just solely for cleaning upstairs on the top floors versus, in my gym where we have three levels, so someone will probably be upstairs cleaning, then there's someone downstairs in the bathroom, locker room. Some places are even instituting that when you're coming in for swimming, that you come already prepared with your shorts and everything already set. And, the CDC currently doesn't have any, I guess, real major recommendations in regards to swimming and what some of the protocols in regards to COVID. So they don't think that right now that's an actual spread. So, people are telling, instead of swimming in certain pools, go for the pools that have been, chlorinated, things of that nature. That would possibly be something that you'd have to think about when you're going back to doing certain exercises.
And Brian, I know I think Mike talked a little bit about the issue with masks and the trainers wearing it. What are your thoughts on the trainers and people at the workers at the gym, and at the same time, people that are working out? Do you think that should be mandatory? Because, let's be honest, putting on a mask while you're running on a treadmill or lifting weights, not really the most comfortable thing. So
it's not going to be the most comfortable thing, but it's something that we're going to have to do inside the gym, inside this sort of closed sort of environment. I think it's very important. It is very difficult to train in a mask. I don't know if you guys actually have endured any sort of hard training wearing that mask, but even in the hospital, working on the units, running up and down the floors with the mask, sometimes it's a little difficult to breathe. And could you imagine doing a high intensity, interval workout and wearing that mask? Most people would probably pass out from that. So now you have to look at what are we looking to prevent? Are we wearing an N95, or are we wearing something just to stop basic aerosols from, liquid droplets from splashing onto your, someone else in the gym? And I think that's something that we have to take into consideration. And I don't think a lot of people know, because we haven't really tested that out yet to see if that's the route that we're going. But I definitely think that the trainers, it should be, we should have zero tolerance with, people not being compliant with these measures. Some people may not think that this will affect them, but it might affect someone else. And I know a lot of people have lost a lot of family members, a lot of friends from this disease, and I think that we should be taking all sort of considerations.
I agree. The only problem with the mask, there's 4 big issues with the mask while working out, at least the way that I see it. One is that while you're moving, let's say on a treadmill, the mask is going all over the place, keep having to readjust it. 2, it does impact the flow of air. Me, myself, I have a hard time breathing through my nose. So I really rely on, most of my air coming through my mouth. And that mask is definitely going to impede the flow of air, which, is going to impair the breathing, make it harder to breathe, at least to a certain extent. And the third aspect is the feeling hot inside, because that you're trapping that hot, moist air as opposed to letting that hot air disperse. So I think there's one more that I thought of. I can't remember, but the sweating aspect of it. So when you're sweating, then it's going to be more likely to slide all over the place. So that's the problem with the masks. I would say people don't need to wear them if they can ensure social distance of not 6 but 12 feet. That's for the people working out. I would say for the people who are working, they would definitely have to wear masks. But it's, for the people who are running on a treadmill, who are bursting out in sweat, breathing heavy, I just think it's, from a practical standpoint, it's not going to be easy to do. And I would say if they're not going to wear masks, keep at least 12 feet between people. But.
I agree with you 100% on that. I definitely feel like, as we said, the trainers, the other staff members, they should be wearing masks, especially that they're not actually, doing the exercise most of the time. So, it would probably be a lot better if we are training in that sort of sense and get used to that. Because another thing is that, wearing certain masks, people can't actually hear what you're saying. So everything just sounds very muffled.
Yeah.
And then you find yourself yelling, and you're it's like kind of like circling the drain in the sense where you're like, you don't really want to spread something, but now you're using more force to kind of get that around and so people that can actually hear you and you can get a message across.
Yeah.
I'll take another perspective on this, because the wellness gym center I have up in Rhode Island is not your 20,000 square foot LA Fitness or Planet Fitness, and from a smaller gym, smaller private gym or private wellness center, what we've taken is almost an 8 to 10 foot distance between each client, and we've really capped it at between 5 and 6 people total. Well, maybe 7 if you're including Nate, the trainer, in there, and sometimes sometimes me. So we have disinfectants and hand sanitizers. We kept it. Masks are encouraged, but they're not mandatory, and that's actually the state of Rhode Island where my wellness center is located. It's not a law where it's mandatory. I just know from a realistic point of view that we might have some people that are going to come in and complain and take the mask off, and it can, again, and when it's not mandatory by the state. So I think it also varies by different states what that rule is. I don't know what the states you guys are in, what those laws are, but we're practicing social distancing, like all the workouts, like all the kickboxing bags, the medicine balls, also all the stations are definitely spread out. We sort of had a game plan weeks and months ago for this, but the important thing is people being vigilant too. It's saying, look, if you guys are having any symptoms, any sniffles, don't show up. Not only for yourself, but also your community, and also trying to educate people. I know people that come to my gym have been following me on YouTube and seeing my Instagram stuff and seeing the severity of the things that Dr. Mike and I are talking about. It's also about like encouraging and teaching people the severity, as you said, Brian. You like myself and several others of us have lost loved ones and friends of ours. So there are going to be inconveniences, and I think it's about balancing it.
So I'll tell you. So I teach at a small kickboxing studio in Brooklyn, where we do a Muay Thai program, Jiu-Jitsu, and we do more of like a fitness class. So usually the way it's arranged, it's 20 bags, and we have 2 people per bag. That's how we did it before this pandemic. Now, trying to revamp the whole system with kickboxing, we're taking that hour class and trying to make it a 30 to 40 minute class, and now we're reducing the number of people in that class where it's one person on a bag by themselves, and there'll be like 3 or 4 bags in between them, and then another person. And so that way that we can try that model and see if that works. And that's something that we're definitely trying to implement, even for our like groundwork, jiu-jitsu. We have a guy from a company called Fist who's making these special suits that we can wear that's like fully protecting your head. And we've trained in these suits before. And although it gets very hot and it's very hard to breathe in these suits, we're going to try that out, for all the members who are partaking in that program to kind of utilize that, because people are going to be very scared coming back, just having that regular contact after 2 months of social distancing and not really making contact with another individual that's outside their family or something.
So Brian, I just want to, Mike, do you have any questions on any follow-ups to Brian on that?
No, I think that was great. I don't have anything to add.
We'll take questions from the audience sort of at the end. We'll dedicate a good segment of the Q&A to everyone else. There's just a couple of sort of major questions we had gotten that we want to hit up. Brian, so one of the things is, I know some of the questions I've been getting and concerns is, despite all these precautions, despite all the gyms opening up and social distancing, masks, and everything we talked about, there's some people that are said, I'm not going to the gym. I'm happy doing home workouts or Zoom workouts. What are some of the things or recommendations, types of exercises that, let's say, you would prescribe or approach?
Oh, I kind of just want to say something real quick in transitioning from the last topic. So that's another thing I would say is, obviously people want to get back to the gym and fitness classes, and all that, who were going before. But if you can work out at home, still better to work out at home compared to going somewhere where you're exposing yourself. I mean, yes, you can take care of all the precautions, but better to do it by yourself than, with that said, and I'm just as guilty of this myself, is I have less motivation at home compared to, when I go out to the gym. So I'll leave it at that. But I think if you can, try to work out at home.
I agree with you on that. I feel like I would work out at home, then I would work out outside, then I would work out at a small one-on-one training session with a trainer. Then I would move to like maybe a small group class of 3 to 4 max, and then I would possibly go back to a gym. That's kind of like the way my kind of stepwise progression of how I would approach that.
Yeah.
And Brian, can you just sort of talk us through? Obviously, the last 2 or 3 months, people have been locked at home with lockdowns and shelter in place and all of that. What someone that's going back to let's say this week or next week, or even working out at home, what are some of the things in terms of getting that flexibility back, getting the strength back? Because obviously, if you've gone like 2 or 3 months lifting weights or getting on a treadmill and doing that, we've always talked about the risk of injury and kind of getting all those muscles and tendons back to where it were, 2 or 3 months ago. What's your approach? What's your recommendations for people going back?
Well, so here's the thing. So I'm one of those individuals that, worked on a gym. I had 4 gym memberships. Was always in the gym. Now, COVID-19 hit us pretty hard and couldn't work out. Now I had to work out at home. Now the philosophy and everything had to sort of change, and I didn't have that much equipment. And if you notice, all the equipment was pretty much being bought out everywhere. You couldn't find anything, and what you did find, prices were like through the roof. It was like Bowflex, kettlebells going for like $400. I've seen even upward prices of $600. So some of the recommendations now for 2019 in terms of like health wellness from the Department of Health and Human Services, they say look at these 3 numbers: 75, 150, and 300. So you're supposed to basically have 150 to 300 minutes of sort of like a moderate sort of intense workout, or 75 to 150 minutes of sort of vigorous sort of training. And I look at during my day, I live at home. Some people live in apartment buildings. Some people have enough space. So it kind of depends on where you live. So you have some of these individuals that they don't want to go outside, but they have a small apartment. What are some of the things that they can do at home? I've discovered, you have a wall at home. Sometimes it can be as simple as that. You can do from wall sits to push-ups on the wall, upside down, doing shoulder, working on your chest and shoulder by doing push-ups in that sort of manner. One of my friends actually has a newborn, and he has a 2-year-old, so he kind of alternates picking up his kids and doing squats. So he's kind of like bonding a little bit, trying to get a little bit of exercise. He's working out in sort of that sense. So people are finding very interesting ways to kind of still stay engaged in sort of this these 2 months that they've been at home. I think that in terms of physical activity, your mindset is just as important as you working out at home. Like, you really have to change the way you think about things, because if you don't, you'll get discouraged. You won't have the motivation. Your behavior patterns will change, and you start falling into these patterns where you're not excited or motivated to work out anymore. So what I found that works a little bit for me is that I've challenged some of my friends where we'll work out on WhatsApp, and this is the goal of the day. So you have to commit 100 push-ups, but you have to record yourself and then send it on the group chat. And whoever didn't do the workout has to kind of pay $50 to the pool and it goes to us. Me and the other person will split it up. So it kind of motivates us, but I also realize there's some people that are not into competition. For me, that kind of motivates me more to exercise. So you have to look at the type of person, what has worked for them in the past, what hasn't necessarily worked. And now we're going to take it from what time constraints do they actually have. A lot of people have given the age-old excuse, I don't have enough time. Even though we're kind of locked away at home, people are still saying they don't have enough time to work out and train.
They don't have enough time, but yet we're bored to death.
Exactly. So even just in a chair, you can work on your triceps. You can do push-ups on your chair. Just like a simple thing. Like you don't really need that much equipment from that you have to buy on Amazon or you have to buy from here or there. You can use just basic simple things you have in your house. Walk around, lift up a gallon of milk. Do shoulder presses. You can do various exercises, but you have to switch up the routine just that way you just don't get bored all the time. And that's the thing. I think people are suffering more from boredom of the workouts than anything else. So if you have a plan, I think that when you look at physical activity is it's movement. But when you look at exercise, it's planned movement. So how are you going to plan your movement and plan it for the day so that way you can engage yourself and maybe engage someone else? A family that works out together, that trains together, it's motivating. You're motivating your partner, and both of you are working off of each other. And I think those things help. So you got to look at your situation, where you are, what's around you. Can you go outside? Can you not go outside? Is your place very limited? What objects do you have that you can utilize? Can you even have equipment in your place? Because some people don't have the space for some of the equipment. Luckily, where I live, I do have enough space in my garage that I converted my entire garage to a gym, and there's a system called PRX, where it's actually attached to the garage wall. When I need to utilize it, it just folds down and there's a full bench, a full squatting station. And then when I'm done, I put it right back up and I put my car in. So it really does depend on some of those things of what you have.
And I think, Brian, as you sort of touched upon it a bit, the diversifying working out. So one of the things is, people think, or just have this misconception, it's either you're lifting weights or you're getting an elliptical and getting on the treadmill. But there's obviously a lot more engaging, fun exercises and things you can do. And also engaging your core, working on your flexibility, because that all sort of ties into lifting heavier. That all ties into running faster, hitting the ball harder, doing all of that. It really is developing flexibility and engaging, having a strong core. And a lot of times they don't require expensive equipment or expensive gym memberships. Can you just sort of describe to us about what are some of the things you would recommend in terms of core training and flexibility that require either no to minimal equipment?
Okay, so for instance, the way I break out my workouts for the week, first day I'll have aerobic, second day is strength training, third day flexibility, fourth will be balance, fifth will be more functional training. And when I say functional training, I have a small garden, so I'm outside gardening, and people gardening is extensive.
Someone just commented that they garden at home, like 1 minute before you said that. That was their really? Exercise, yeah.
Yeah, that's considered functional training. You're getting down, you're squatting, you're pulling out weeds out of the ground. Like these things can be very labor intensive. And then my sixth day would be like speed, and my seventh day would be core. And so some of the core things that I would do, so you can take it as far as or as simple as, starting off with a simple basic plank. And every day I try to add 10 seconds to that plank, 10 to 15. Or if it gets to a point where I get bored of planking, then I'll invite one of my cousins, like, hey, you want to do a plank challenge with me? The prize is I'll give you a $25 gift card if you win versus if I win. So we'll record ourselves. And I actually engaged a couple of my family members to kind of get involved. And so now we have like a group family WhatsApp plank challenge, and we'll just send videos. So it's like, you're getting bombarded with text messages, but everyone's doing it because everyone wants the gift card and they really don't want to really train or work out. And then you also move to like, there's certain devices. There's something called the self-core trainer. I think this item costs roughly about maybe $250, $300. And basically your iPhone sits on this sort of a plank machine where there's like a round circular ball, a half moon on the bottom, and it kind of rotates as you're moving. So you hold first in a plank position, you press go, and then there's a small like asteroid, and as you're moving, you're blowing up the asteroid. So it makes working out and core training fun without you actually thinking that you're actually doing that sort of core training. So there's multiple things that you can do, whether or not you want to purchase a product versus you just want to start off at home and challenge yourself. And I think people need to stop comparing themselves to other individuals. They just need to be a little bit better than the person they were a day before, because you always look at all these pictures of everyone else and you say, wow, I'll never get like that. I'll never get to that level. And you can. You just have to do it within your own right and within your own means. The biggest thing for people is the level of discouragement that they get when they start off and they go way above the mark. I say start off slow, work your way up. The problem is a lot of people, they want these results very fast, so they start off really, really hard, and then they end up failing, they end up injuring themselves, and before you know it, they're not motivated to work out and train anymore, and then all of it is gone.
Yeah, one of the things for me as far as staying consistent, and that's the hard part, is staying consistent and not putting too much on your plate when you start out with, is I'm just as guilty of that myself. And then, I'll kind of put, my foot down and go all out. And then the next day, my lower half is totally sore. And I'm like, I can't even walk. So I'm not doing abs today because I can't even move my legs. So it's like balancing, how much do you start off with and gradually getting more and more. That's always a challenging aspect of it. But for me, what I do is, I like to mix it up with weights, but also with sort of like high intensity stuff. So before I go to the gym on some days and other days, I would do actually T25. I don't know if you heard about that, but
yeah,
it's like basically, then it's like Insanity, but a shorter workout. So it's like 25 minutes, and it's a lot of different calisthenic type stuff or high intensity stuff, and mixed with aerobic type stuff. And I'm gassed, man. I'm like halfway through that, and I'm gassed, and I'm hitting the pause button. I'm like, you people need to hold up. Like I can't breathe right now. I need a break. And then like it might take me like 40 minutes because I'm so gassed, but it's supposed to be a 25-minute workout if you don't hit the pause button. But you really don't need anything. You don't need any weights. Maybe the exception is if you do some upper body stuff, couple dumbbells that are light. But other than that, maybe a mat, but you don't really need any equipment. And if you do that, not only will you maintain strength, but you will get in really good shape doing that. It's literally 25 minutes, however many times a week you want to do that, 5 or whatever. So that's just what I do. I've been doing that since before COVID. And that's what I do now at home in my room. I just have a little space, and that's what I do. So, everyone has to figure out what works for them.
So Mike, just exactly what you said. But you've been doing this consistently before. There are a lot of people that have had maybe family members and we all know that one of the things that we have found about with COVID that, chronic inflammatory states, obesity, a lot of people have died from it just from being obese. So now a lot of family members have looked at some of their loved ones who have passed away, and now they're saying, whoa, I'm maybe a little bit overweight. I don't want to end up like this. And that might be the motivating factor to get them to start moving. And, I think that people should start off when they're thinking about their exercise program or exercise regimen is, okay, what is realistic for me? What is safe and what's effective for me? So can I start it? Can I do it once a week, twice a week, 3 times a week? And then from there, you kind of break it down and move towards what intensity level are you going to work out at? I always say start off moderate and mild, and then work your way up to vigorous. And it's kind of like when you look at what moderate, I look at what is like your rate of perceived exertion is. So if you're talking about moderate activity, you can say some phrases. You can say easy sentences, but you're not having a full-on conversation. You're not having a full-on conversation, and I think that when you look at vigorous sort of activity, there's only a few words that are coming out of your mouth. So if people want to engage what's moderate versus what's vigorous sort of intensity, those are some of the things that they should look at. And then once they figure that out, work out with the time, with how much time they actually going to have to actually do this and commit to it. And then they can break it down into those sort of different types of activities as we discussed: aerobic, strength training, flexibility, functional, core training, balance. And then once that's all done, you kind of also say to yourself, well, do I have any injuries? Do I have any limitations? Do I need to do low impact versus high impact activities? Some people cannot, a lot of people have hip injuries, knee injuries. They can't do a lot of the high intensity burpees and jumping push-ups and things of that nature. So once they look at all of those things and they say to themselves, okay, this is my plan, this is what I'm going to do, then the last thing that they should look at is enjoyment. Like, are you going to enjoy what you're doing? Because if you're not enjoying it, it's not going to be fun. So I think that people should look at it like that. Like, some people love gardening, and I think that that's a great way to exercise. And people may not think that it's effective, but any sort of movement is actually effective. Like, their recommendations have completely changed now in terms of physical activity. Everything counts. So I think that's kind of like the way people have to sort of like approach these things.
Yeah, you had a lot of great points in there. There's, like you said, there's something about just not sitting down. Not sitting down is better than sitting down, and that's actually has a lot of benefits just in itself. And you're absolutely right. Everyone's got to find what works for them. If someone's not enjoying it, they're not going to continue to do it, no matter what. They'll stop. Not too far down the road from that point, and then everyone has limitations with their hips or their knees or their breathing, whatever that is. I know also you hit on obesity, and that's one of the risk factors for getting COVID and having a worse outcome from COVID. Having more severe disease, that's a risk factor. So that's another thing too. It's not too late to start exercising now, and that goes for a lot of things with health, whether it's quitting smoking and whatnot. But getting someone who is obese to start exercising in addition to eating healthy, it's not too late, and it's very important, especially in a time like right now. So I guess, what would you say to someone who's like, I've never worked out before, who's like, I really need to work out? How should I start during this pandemic? What would be your recommendation?
I think some of my recommendations would, there are some people that haven't utilized any sort of gym equipment ever, but there's certain basic exercises that you can start off with that can target different things. While people are waiting 10 weeks for their fitness equipment to come in, you have a wall, you got cans of food, you have a couch, you have countertops, and you may have small children running around in your house. These are all things that you can possibly utilize as some things that you can do for, to help you along with this sort of exercise regimen that you're about to embark on. So I would say start off slow. Let's see what you can do. Instead of doing a push-up and saying, let's go straight to a push-up, how about start off with just holding your body up? Let's say you hold your body for 15 seconds. Next day, you work your way to like 30 seconds. Then you can go to a minute. And like I said, not everyone can do a push-up. Then you can move towards, okay, now let me work on that now let me get the motion going. So I'm going to do the push-up, but I'm going to do the push-ups on my knees. And you work with that. And then I think gradually you can start building into actually doing a full push-up once you start building up that time. But you see how we're starting off slowly. We're starting off with a minute, 2 minutes, 3 minutes. Don't look at the number, just look at the time and see if every day you're building on that time that you're giving yourself.
And maybe if they're able to, mix in some jumping jacks or something, and if they're able to, who knows? Everyone's different, like we talked about. So
I think it's important, Brian, like you said, it's because that's people have excuses. Oh, my back hurts, my knees hurt, my ankles hurt, I'm too tired. And one of the things is, I think you might have known from my residency when I had a bunch of herniated discs and they found a tumor in my L1, and that one neurosurgeon at Kings County Hospital wanted to operate on my back. And one of the things that, instead of going for that surgery, I ended up just started working on my core and strengthening my core and lifting weights. I have a really hard time doing deadlifts, but using light weights really helped me strengthen my back. doing battle ropes, kettlebells, sled, and even with a sled, you can take anything. You can put a box and put some old books in there and slide it at home, slide it in the grass outside. Take an old wheelbarrow or something and put some sand in it and work out. There's so many different creative ways of doing it. It's not just lifting weights, running on a treadmill. And just the point that I think both of you and Mike had talked about was, obviously we're going to be concerned about the second wave. That is the reality. And in some states that you're starting to see increase in the cases for whatever reasons. And even if it's not this COVID-19, I think we are all concerned about future viral infections and pandemics. And, one of the things people talk about is supplementation with vitamins and zinc and all these essential nutrients, but exercise is a really big, important. Can you talk a little bit about, obviously there's a lot of reports about how COVID-19 is also an inflammatory disease. There's some sort of inflammation taking place. Can you sort of talk about how exercise can maybe play a role in some of those COVID-19 issues?
Well, if you start looking at obesity in general, so you're saying what happens in obesity? So people are at risk for what? Strokes, they're at risk for cataracts, diabetes, hypertension, venous stasis issues, cancers. All those things, all these things, even the respiratory complications, obstructive sleep apnea, having just difficulty laying down, difficulty sleeping, difficulty laying on their back. If we think about all the patients that we've had in the ICUs that were COVID positive, that were in their most severe state, that were obese, all those problems just made everything a lot worse. So they didn't have enough to take in maybe an extra breath, so they weren't at the point where they were gasping for air, or they just felt severely restricted. They didn't feel like they had enough to push forward. They got tired up very easily. So some of these people, that were in that sort of state, it made their disease process just complicated, just made it worse because they weren't giving themselves an optimal chance to fight off this disease. And I think that, for those that are kind of struggling with some of those things now, in addition to them making those sort of changes and starting to implement an exercise program, they also have to implement an adequate dietary intervention where it's not just a dietary fad, but more of a lifestyle change and something that they feel that they can stick to, so that way the combination of them exercising and eating can both help them with decreasing them, or kind of just allow for them to have significant amount of weight loss. I think that, like we said, with COVID and with all the patients that we saw in ICU, and I don't know if you also shared this experience in your hospitals, like it was across the board. I called my friends in other ICUs and we all saw the same things. There was a lot of morbidly obese individuals that were doing very poorly because of just the combination of COVID with their obesity.
Right, and we also know that obesity plays a key role in decreasing FRC, which for the non-medical staff, it's the people here, it's the functional reserve capacity. I got to think of like med school terms now, but basically what it is, it's your reserve of oxygen. And in obesity, it's proven that you have a decrease in the amount of oxygen reserve in your lungs. So, and a lot of things, the other thing too, talking as an anesthesiologist, a lot of these COVID patients that are obese and having severe symptoms, a lot of them, some of them had to come to the OR trachs and feeding tubes and having other procedures. Now, when you're giving the anesthetic, you're even more, there's more complications because you have that decrease in that oxygen reserve when you give the anesthesia, along with the COVID, the infection in their lungs. So it's like triple, quadruple whammy. And it seems like when you sort of take those necessary precautions with eating well, and I mean, if people were struggling with a motivation for going to the gym and exercising, just the fact that there might be a potential second wave, I think that's going to be a motivating factor right there. Because it's like, wait, I want to do everything possible. And it's not just popping a bunch of supplements and eating well too. I mean, we all know, how much, and I don't even think it's exercising. I think it's exercising smart and not just, just running on a treadmill or just going lifting weights, having a sort of a much more diverse approach to it, where you are doing some functional training, you're doing some weights, you're doing some running, and also your daily activities, going to the grocery store, lifting those bags, walking up the flight, taking the flight of stairs instead of an elevator. I mean, how many times in our hospitals do they say, be healthy, don't take the elevator, take the stairs? I mean, so all of those things add up, as Mike was also talking about earlier.
Yeah, it's those accumulation of small decisions that really, in the end, make a big difference. So, will taking the stairs one time make a difference? No, but you start doing that on a consistent basis, and you're going to see a big difference overall. Had you not done
One of the
and Brian, you do. Sorry, go ahead.
no, one of the things that we have seen, after 2 months of some of the patients that have been in the ICU, some of them have come back. So we've had like one young lady who was intubated for approximately 4 weeks, and she was discharged from the hospital, and her lifestyle before, she was moderately active, and now the question that she posed to all of us and me and a couple of other individuals at our hospital, other physicians at our hospital, was how should she go back, in regards to training. Now we're talking about someone who now has a reduction in her, lung capacity at this point. She feels like when she goes up a flight of stairs, it's a little bit more difficult for her to actually go up a flight of stairs, whereas before COVID, she was running up and down the stairs. And so now, she has to follow up. We told her, listen, our recommendations are, you should take this very slow. You should be, in constant consult with your pulmonologist, and they should kind of be working with you to help get you back on the road. Because you look at her CT scan from started and from now, there are some changes. We did see some significant reduction change in some of the damage of the lung parenchyma, but she still has some of that ensued. And so now when she's doing basic activities, basic ADLs, she can't really function as well as you would think she would. Going from one side of the room to the next, it's actually a little difficult for her. And I think these are a lot of the things that we're all going to be seeing, in the upcoming months, of people who've been through this disease, and now where do they go from there to try to rehabilitate and rebuild themselves? And I don't know if you, like I said, if you've seen any of these sort of things, Mike, if or Dr. Yo, if you've seen any sort of these things in your hospitals, or seeing some of these patients back for follow-ups.
Yeah, one of my patients, very similar boat as what you just described, and he had the virus. I mean, he's cleared the virus, but his lungs have been damaged, the residual damage from the lungs, and he's either on minimal supplemental oxygen now or just came off supplemental oxygen now. He's in his 40s, and that's, very unusual for someone to require supplemental oxygen for that long just from a one-time infection. Usually, if someone's going to get an infection of their lungs, they get better within, if they are going to get better, they get better within a month or so. So with COVID, he's been recovering for about 2 months now, and it's just taken a lot of time for his lungs to get back to where they were. Hopefully, they do get back to where they were. Unfortunately, there's nothing that I can tell him that's going to accelerate the process of his lungs healing. So I'm glad that he's making progress, although I know that he's frustrated that the progress isn't as fast as he'd like it to be. But what I do tell him is, look, just take it easy, do what you can, and don't overexert yourself. And you just have to be patient. Of course, easy for me to say, but you just have to be patient and let the lungs heal slowly over time, and don't overexert yourself. And that's really all I can tell him. It's still good to be active, still good to go for walks, still good to exercise within your limits without overexerting yourself.
It's interesting. We make these recommendations now for patients that are, status post their COVID infections. Also, at the same time, a lot of people who may be listening probably haven't worked out, in a very, very long time. And we also don't know what's going on with them. Some of these people can have, recent acute MIs, unstable angina. Some people may even have aortic aneurysms that they don't even know about. So it's like, where do they start? Where do they start? And I think some of the recommendations should be, yeah, your doctor does know a lot of your medical history. Talk to your doctor. Say, hey, you know what? I'm considering going to try to make an attempt to start to work out. Hey, do you think do you think that's okay? Do you think there's certain things that I shouldn't do? During this whole pandemic, we've had a decrease in MIs that have come to the hospital, and people who are sick from other coronary events. And we kind of say to ourselves, what happened to those people? I mean, it's not like their heart attacks kind of stopped because COVID happened, or because of this pandemic. So some of these people possibly died at home. Some of these people may have just found other ways to kind of abate sort of their symptoms, but some of these people still have these things going on. And although they may not be rushing to the hospital, which I think they should be coming to the hospital for, I understand a lot of people's fears. And these are some of the things that I think a lot of people should take into consideration. If they haven't been active for like 2-3 months, they may have some pre-existing coronary disease. Like, these are things that you should be thinking about. Don't just jump into activities. Don't just jump into working out and training extensively without first, consulting your doctor and seeing, based on your history, what do you actually have? What can you do?
Yeah.
And I think you bring up a really good point, Brian. And one of the reasons why I ended up even making videos on YouTube before even COVID was, and I've talked to Mike about this too. You and I spent years talking about this, how in the world of fitness and exercise, there's just no regulations. Like, all three of us, I mean, we have a board, state board, our anesthesia, in Mike's case, he's got pulmonary critical care, his boards, we got sort of ethics committees. And so what we say, we have to be really careful, and we're judged very harshly by our peers. It's not social media, it's not the public. Our peers are going to judge us very harshly. I think I'm pretty certain that Mike will probably agree with that too.
Yeah.
We don't want to say anything that we're going to be going against what the standard and what our peers are saying.
That's why we have to be very careful what we say, and it's always walking the line of how we say things, because one thing can be interpreted in multiple ways. You have to be very careful the way you say things. Yeah, absolutely.
But one of the things, Brian, you have a unique background. I mean, I think Mike probably the same way. Mike's got a background in exercise physiology, and you are also, and both of you are physicians. And I guess all three of us are really into the fitness world, me running ECA, and you guys, in your own respective workouts and training. But Brian, you also do like training, right? You have a personal training background, so you kind of you're merging allopathic medicine. It's like having a physician as your personal trainer. I've always found that to be pretty interesting. So can you talk a little bit about? Yeah, go ahead.
No, well, it's very interesting. We talk about merging. These are things that we as physicians should be doing in general. We have kind of separated it to the point where now we're just taking care of dealing with current disease status. Why aren't we out there helping patients and helping clients, helping people do sort of the preventative work? Start some of these programs where we're encouraging people to work out, to exercise, to do some of these things. And I feel like we've given those things away when it's all encompassing and all part of the whole sort of health spectrum that makes us what we are. So because when patients are finished with, let's say you take them down the road, they had an acute MI, and now they went to the cath lab, intervention was done, and now they're in cardiac rehab, and now they're home. Where are they going to start now? Now, had we been there in the beginning, maybe they might not have gotten there. But I feel like a lot of these things that we're talking about now, a lot of our patients, we should be helping them earlier on and should be motivating them earlier on. And I'm not saying all physicians aren't doing these things, but I feel like we should be doing a lot more of those things.
I agree. And the thing of it is, like, we all have our own specialties, and all of our specialties overlap with every single other specialty in some way, shape, or form. So when you talk about preventative medicine, you're exactly right. Exercise prescription is for prevention, but also to help treat certain diseases. So when you overlap the specialty of family practice, which is a lot about prevention, and you overlap that with internal medicine and cardiology and pulmonary, when you overlap all these things, it could really focus on that aspect of exercise. So in a way, it's like exercise could be its own specialty in the future. And I wouldn't be surprised if it becomes its own. Oh, I overlap that with physiatry as well. So when you overlap like all these specialties, what is their commonality? It's really like exercise and prevention and everything that you just talked about. So really, there should be, um, a specialty. I know there's kind of branches of sports medicine also within there. So when you can kind of combine all those things, you really have your own specialty that could be its own residency in the future. I feel like.
It's a real good point.
I
Go ahead, Brian.
just want to say, we also rely on a lot of data. Like the way that I train, I have heart rate monitors, I have different devices that track different aspects of the type of movement and the functional movement that I'm doing. So whether or not I'm utilizing my Apple Watch, or I'm on my Peloton bike with a heart rate monitor, or I have a jump rope that counts the amount of revolutions that I'm doing within a certain minute, I always like measurable data. But you have a lot of people out there that are not utilizing some of this information, which I think it can be very vital and very important. And you yourself, Dr. Yogendra, that there are times when you use this with some of your clients and your patients. Is that correct?
Yeah, that's the big part of my training program. It's heart rate training, but it's it's using the different types of zones. And so I usually use 5 heart rate zones, and I've made a video about that. I'll post a link to it after this session is done, so people can get a little bit of better idea about what that actually means. For certain zones you're working out, you're going to be burning more fats and carbohydrates, vice versa. So it's about getting that understanding. And right now, because there is a lack of oversight and regulation, people coming out and just really saying whatever. And like I said, as physicians, we'd be really, really careful. So everything that we've been talking about is really based on science and sort of exercise physiology. We're going on a very cellular level, talking about mitochondria and oxygen and transporters and ATP and whatnot. But my point is, it's about, and I think you guys will agree, it's about diversifying. It's about having the different, low heart rate zones, whether it's, you want to do light weights versus like kickboxing and MMA kind of style, which gets your heart rate up to really, really high zones. And people think because I'm working out at a higher zone, I'm burning calories, that's the best. But actually, you actually get more benefit. Studies have shown by working out at lower heart rates, the zone 2 training, which is about 60 to 70% of your maximum heart rate. And like I said, all of this stuff right now, it's so confusing. And that's why I started making videos before coronavirus happened, just to really explain some of the basics so that people have that knowledge and information. And Brian, you have a Instagram, right? Can you share your Instagram page with us so that people want to get in touch with you, really talk about the exercise and sort of your training methodologies that they can reach out to you? What would that be?
It's MD Fitness, the number 4 and life. For me, like I said, I do this because I want the information to be out there. So if anyone, has questions, feel free to contact me. If you need help with kind of making programs and things of that nature, just feel free to contact me. I'll send you, a week's worth or 2 weeks of sort of activity, what to eat, things of that nature. And like I said, I'm not asking for money. I don't want any money. I'm just doing this because I enjoy doing it. I enjoy training, getting the information out, and helping people just to, be a little bit better than before. So again, that's MD Fitness, the number 4, and life.
All right, I just typed it in the comments so they can all see that there now.
Yeah, I put it on my end. And you guys want to take some questions from I got a couple of questions, and maybe we can, people have more questions. Brian, there was a question someone asked about, I guess she had a COVID-19 infection, had also some lung issues, and she said, is 30 to 45 minutes enough of walking? Is that a good start for someone with, recovering from COVID-19 infections? Also, I think she got some COPD with some asthma.
So what would be your recommendation? Someone like that.
Now this question becomes a little bit complicated. She had a little bit of an infection before, which status was, so we don't really know what the damage have ensued. Now you're telling me on top of that, she also has asthma and COPD. So now for her, it's kind of making an assessment of saying to her, what is it that you do normally that you don't have a problem with, and what's starting your problem? So where in your normal day-to-day in your life does it go from that sort of having that less intense to getting to the moderate where the phrases become a little bit less? Is it from you walking from end of the room to the next? Because that's a lot different than you going up and down 2 flights of stairs. So now I would say for her, let's see where those measures are. And like I said, she wants to contact me on Instagram, not a problem. I can go through a lot more details that she should do. But she should start off very slow. And she should actually start working and denoting what her progress is, what's becoming uncomfortable for her, and what is her recovery from her level of being uncomfortable. Is she taking 10 minutes to recover from that? Because then that's a whole different sign that maybe there's something else is going on. We don't want to tip her over the edge of the curve if she's just recovering from COVID-19 plus on top of asthma and COPD. So I would recommend for her, hey, let's take a look at the whole picture before we just go, because everyone's different, and we can't have these sort of like cookie cutter sort of just regimens for everyone and just fit it one size fits all. Everyone has to have a different guided program. And someone asked me, I said, I gave one of my friends who had a COVID infection, who had some lung issues, I gave her a pulse ox. And I said, let's look at some of these metrics. Let's look at some of these numbers. What happens when you're doing certain things? Are you desaturating, like things of that nature? Now let's make a book. Let's make a log. What activity have you done? What's impeding you? What's stopping you? And are you actually benefiting from this? Is it improving over the course of a week? It may not improve over the course of a week. It may take a lot longer, but if she's doing it where it's consistent and she's starting and she's seeing some sort of improvement, maybe over the next 3 weeks to a month, then I see she's moving in the right direction. But if she's not, now we have to talk, and like I said, her pulmonologist should be involved also, because now she wants to get back, but we don't want, her, the lung disease and some of the other lung ailments that she suffers from to complicate and make things worse.
Any thoughts on swimming pools? A couple of people asked questions on swimming pools and saunas. Because I know some of the gyms have both of them. You guys have any thoughts on that, Mike, Brian, about
swimming pool thing? I definitely, like I said, if the water is chlorinated and checked, I think that might be a better option than just swimming, because I know there's different ways to treat different pools. Some people use different salt solutions. Some people use chlorine based. I would probably opt to go more for the chlorine based swimming pool. Sort of get my sort of activity and exercise. I mean, I kind of only wish I knew how to swim. I mean, I don't know how to swim, so maybe that's something to start, learning. What are your thoughts, Mike, in regards to the swimming aspect?
Yeah, I mean, I don't know as much about all the different aspects of that process. Definitely, I would think that the way that should be handled is by bleaching, but I'm not sure exactly how much would be spread if you have people in the pool. How do you maintain social distancing? If it's a laned pool, have every other lane occupied, not lanes next to each other, because then when someone's turning their head, especially when someone like me's in the pool and they're all awkward and uncoordinated and they're going like this, it's definitely going to be reaching to the next lane. So I would say at least space it where people are in every other lane, and then no groups within the pool. So maintain that distance as well of at least 6 feet, depending on what the group is doing. I would say more comfortable would be 12 feet. Can't do masks in the pool for obvious reasons. I mean, unless everyone's staying above water, but so it's such a unique situation because we never really have run into a similar problem before where you have a respiratory virus in a pandemic, and how does that affect the pool? So I think there's a lot of unknowns with that. Um, and I would think you would try to implement the same social distancing, the same rules as you do out of the water, but it would need additional rules, with the water, with the bleaching and whatnot. So
And I also think that I think people will start looking at this the same way we started changing a lot of our management in the hospitals in regards to this pandemic. You know, when I look at the gym when it opens up, I'm going to take a look what happens the first week or the first 2 weeks because things are going to change. They're going to implement different, policies as time goes on based on what they've seen and what they've noticed. And I think a lot of people, are going to kind of look to see what happens the first 2, 3 weeks of people going back to the gym. They might have friends that go to the gym like, hey, anything going on, or kind of see before they kind of take that step to start going back.
and I think you hit it on the head earlier with you do it in phases, and that includes with the gym too. So not all gyms are going to be able to reopen because they're not all going to be able to, abide by those rules or implement those rules. So if you do it in stages, or you start with the minimum, kind of like what we talked about with workouts, you build your way up. So you start with the minimum and then gradually get more and more closer to where you were before the pandemic.
Mike, I think this may be a question directed to you. I guess it's probably also exercise related. And Brian chime in too, because I actually haven't heard of this. Someone talked about they purchased an oxygen boost online, and she said that some people use it and experience coughing of blood. And she says, would that be due to velocity issues? Have you guys heard of this before?
I'm not familiar with oxygen boost.
No, me neither.
Okay, so I didn't. Yeah, I don't know if this was like exercise related. There are all sorts of things online. I just didn't know if you guys had heard of it. I hadn't. So
Please tell me to message me about that sort of stuff. I definitely would like to, read into it and see what
okay.
see what it is about that.
Yeah, sure. Mike, do you have any questions from?
Not. I think we already talked about everything that I've seen questions about right now. That have to do with exercise anyway. So.
Mike, there was one question. I guess you'll probably be the best one. What is a good lung capacity baseline test?
Difficult to answer because the way that when we look at pulmonary function tests, it's based on size of the person, so height, weight, sex of the person, age of the person. So all of these things go into what determines is a normal pulmonary function. For most people who are adults, their lungs can hold about 6 liters of air. When we've been talking this entire time, that's called a tidal volume. On average, we're inhaling about a half a liter and exhaling half a liter. So that's normal breathing, normal conversation. When you inhale as much as you can, the biggest breath that you can inhale, for most people, on average, for an adult, it's going to be about 6 liters. There's other parameters that we look at for pulmonary function tests. That includes how much you can blow out total, how much you can blow out total in 1 second, the amount of gas that remains in your lungs after you blow out everything that you can blow out. Lots of different parameters, and they tell us lots of different diagnostic information in terms of different diseases. So there is no normal for anyone. It really depends on a lot of different factors.
Great. Mike, any final thoughts? And we'll take some final questions too for Dr. Phillip. But do you have any final thoughts, Mike? And then we'll.
Someone was asking Rachel Kingsley, who is a big time follower on the channel, and she's always at these live Q&As. So much respect to you, Rachel, and thank you for always showing up and asking questions. I see she asked the question: should we vitamin D supplement? And that's a big conversation. I did make 2 videos on vitamin D. One is vitamin D in general, and then vitamin D in relations to this pandemic. Um, Between those two videos, that's probably 20 to 25 minutes worth of conversation. Uh, the short answer is taking 1,000 IUs every day isn't going to harm anyone, while at the same time, it's going to prevent people from being vitamin D deficient. It may help prevent getting upper respiratory infections. It may help with preventing COVID if you are low. So, my recommendation to most people is 1,000 IU every day. That's what I take. That way, you're not going to be low, yet you're not going to run into any adverse effects, any side effects with that dose. So that's a very general recommendation, and I think that's fine if someone were to take that.
And just one thing about
and Brian,
just one quick thing about
oh,
vitamins.
no, I was just going to say, Brian, your thoughts on it. Yeah, go ahead.
Yeah, so, well, first of all, because we all know that vitamins aren't really regulated, there are actually some outside companies that actually check these vitamins to actually verify that what they state is in it is actually there. Because I remember CNN and a couple of other news stations were referring and saying that they broke down some of these vitamins and they found that the people were getting like ragweed and all these other things that are actually causing more harm. So some vitamins have seals of approval that's verified by outside companies just to verify sort of things. Now, as far as the vitamin D levels, I honestly believe that if your vitamin D levels are low, it should be corrected. I don't think we should be at a point where we're overshooting, but I definitely think that this may help, especially from the studies that have shown that what happens in terms of vitamin D levels and vitamin D supplementation and respiratory function. So I definitely agree with Mike on that if your vitamin D levels are low, you should have it where it's optimal and where, but that's another thing. Do you know where your vitamin D levels are? A lot of people are taking supplementation and they don't even know where their vitamin D levels are. Are they normal? Are they way below normal? Or, are they, after taking, I had a lady who told me she was taking every day, she took about 10,000 IUs of vitamin D. And I said to her, I said, well, do you know where your levels are? She's like, no, but I just thought that I would take that amount because I thought that would be best. And I was like, first get your vitamin D level checked before you start the supplementation.
Especially with that big a dose, yeah.
And also, when you're taking the high levels of vitamin D, it's really, when you talk about the 20 to 50,000 IUs, they're really under the direction and guidance of a physician, whether it's your primary or your family doctor, that is closely monitoring that, not just self-medicating yourself.
The only problem is right now is the pandemic. So less people are going to the doctor. Less people want to go get blood work. It's more exposure for everyone, especially people who are already very prone to getting the virus or having prone to getting a worse outcome. So in an ideal situation, yeah, you want to get your levels checked. From a practical standpoint, that's why I say from a practical standpoint, it's probably here take 1,000 IUs because you're not going to run into toxic levels with that. Yet you're not going to be vitamin D deficient if you're getting 1,000 IUs every day. So ideally, you do want to get your levels checked, but again, not practical for everyone.
And I think it's also like looking at your lifestyle too. If you're someone that works outside or work in a building where you've got big giant windows, and you're getting that constant sun exposure, and you're obviously in your diet too. But what's really interesting, when I was in residency, remember those days, Brian, when we were at downstate, there's no windows in the operating room. We were there for like 12 to 15 hours a day, and I got my vitamin D levels checked once on a physical, and they were low. I said, how is this possible? But healthcare workers, I don't know how your hospital is, Mike, if you've got windows. Usually some of the nicer hospitals that you work at will have windows. The ones that Brian and I trained at, you might find like one creaky window that the whole hospital is just trying to get a little ray of sunshine.
Hospital's not the best place to get vitamin D or sunlight. But Brian, you made a great point too. Is with the vitamins is independent testing from independent companies who look at what is the purity, what are the actual contents of the vitamins, and that's a great point. I personally recommend consumerlab.com. where they test everything from vitamin D to CBD oil. They look at how pure it is, other contents of it. They look at the value of what you're getting, the concentration of what you're getting, and that's a very good website that I recommend. It's an independent website that tests all these different vitamins. So definitely do your homework before buying things. I recommend checking out that website.
Yeah, but any questions for Dr. Phillip or Dr. Hansen or myself? Also for Dr. Phillip, because he's our guest today. So, you guys have any other questions about exercise, fitness, or nutritional diet questions? And if you guys can think of anything, you can hit up Dr. Phillip at MD Fitness for Life. Is that correct, Brian?
Yes, MD Fitness, the number 4, and Life.
Okay, someone had a question. What does it mean when you step down and your feet get a cold, tingling sensation? I'm not sure, like a real cold feeling.
These are things that would have to be looked at by your doctor, and because that involves taking a full history and physical and possible diagnostic workup. So off the top of my head, it could be just about anything, but nothing that really jumps out saying, oh, it's most likely this, most likely that. It could be really anything. And my recommendation would be to talk to your doctor.
Yeah. All right, Brian, do you have any final words that you'd like to say just to wrap up our session?
Listen, I would just like to thank you guys for having me on today, and I'd just like to thank the listeners for tuning in today. And honestly, I just tell people every day, you're only as good as your last training. A lot of us tend to think about the things we've done in the past, like we were all-star track and we did all these things, but the question is, what are we doing now? And we have to make sure that we're not looking back at the past, reminiscing and living in the past, while in the present and the future, we're not doing those things to help propel ourselves so we can live in the future. And, the only person that you're competing with is yourself. So at the end of the day, when I look in the mirror and I say, all right, how was my work? How was my training? I'm not looking at someone else's progress. I'm looking at mine, and I kind of just take it from there and just, every day just be a little bit better than the day before. And, usually at the end of all my workouts, at the end of the day when I'm having dinner, I just, try to have a lot of water and just a little bit of wine. And that usually is enough to just, keep me going for the next day.
Speaking of wine, can we there it comes.
Well, I just want to say you're doing it perfect in every aspect, Brian. Your words were perfect. Great advice. You got it going on in your life. Even the background is perfect.
The wine in the center. Exactly.
Yeah, Brian. So we got your Instagram. So if people have any questions, they can directly contact you. They can also email Dr. Mike and myself, and we'll get you those questions and help people with their training, nutritional questions, supplements, things that they have out there. Like we talked about, it's not a regulated industry. So, and we're not saying we're the regulators, but at least we can help people point them in the right direction. The other thing I was going to say is Dr. Hansen's channel is Dr. Mike Hansen, right? On YouTube,
my YouTube, my YouTube
Hansen
channel.
Instagram.
Yeah, my YouTube channel is Dr. spelled out Mike Hansen, Hansen, and then my Instagram is Dr. spelled out Hansen. I'll put that down here in the comments.
And my Instagram is ECA Wellness, and my YouTube channel is Dr. YO. I got one more question really quick. This person, Jian, has asked this question a bunch of times. I'm sorry I didn't get around to it. The AC system safe in the hotels he needs to travel. I haven't heard anything about the HVAC systems in hospitals and hotels. Have you guys heard anything regarding that?
I don't know. I haven't heard anything.
No,
Yeah, I haven't heard anything either.
but you
Yeah.
know, it's just you just need to definitely be in well ventilated places. Open windows. Because you look at some of those studies that showed aerosolization of certain disease pathogens being closed in the same environment without rooms being open and without proper ventilation. And people got sick from those things. With that being said, so I really haven't heard anything about the air conditioning systems, but definitely should be in a place where it's well ventilated and hopefully open up a couple of windows or two if you're in a particular place.
Great. Any questions?
I know just the one more last one was if someone's at higher risk of COVID, the question is, do you recommend I work out at home versus at the gym? My recommendation for everyone would be to, if you can, work out at home. That's for everyone. And I think that is even more so for someone who's at higher risk, just because you're
Right.
trying to minimize your chances. And on the flip side, I know people want to go out who want to work out where they were working out at. Also, the motivation factor. A lot of people like being at the gym for that reason as well. But if you can work out at home, that's my recommendation. And when the gyms do reopen up, they're going to reopen up slowly. Not all of them, but some of them will open up slowly. My recommendation again would be to work out at home, and when things are more closer back to normal, then really consider going back to the gym at that point. But for everyone, especially if you're higher risk, work out at home. That's my best advice.
And guys, I got one more question, and this is really not exercise question. I've actually gotten a couple of these questions on Instagram. Have you guys heard of this MAP protocol, MATH plus? I think it's I forget, it's the Eastern Virginia Medical School might be talking about this. It's where they're giving methylprednisone. I think they're giving vitamin C, thiamine, and heparin. And I think it's some sort of protocol for the inflammatory response to the virus. Have you guys heard of that, and any thoughts on that?
Well, I've heard of that for minus the heparin. So that university, Eastern Virginia, actually did that same protocol for septic shock patients, where initially it's a very small number of patients in that trial, but there's initially a lot of hope with that because there were some positive results saying that when we did this for septic shock, it looked like it had significant improvement. But again, the numbers were small, and you didn't know, is it more the steroids working? Is it more the vitamin C working? Or is it more of the thiamine that's working? Or which two out of the three, or which one out of three? So then there was a follow-up study based off that study where there wasn't promise. It didn't show that it was significant. So that's basically taking, at the same university, Eastern Virginia, taking that same protocol, or at least the same medications, and then adding heparin to it. Will that be beneficial? We don't know. We do know that steroids are very controversial. And then, vitamin C for someone who's in the ICU with COVID, there haven't been any randomized controlled trials, at least that have shown any beneficial effect on a randomized controlled trial. So the heparin makes sense though, because 30+%, about at least 30% of patients who have severe COVID have blood clots. So if you get positive results in that trial, which of the four medications was it? Or was it 2 out of the 4, or 3 out of the 4, or 4 out of the 4? If you do get positive results, I'm pretty sure it's because of the heparin, if anything, compared to the other 4. But that's as far as I can comment on that. I don't know the details of the trial, and that's all I really know about that.
Brian, anything that you've seen in your ICUs on that?
No, I mean, mainly with the heparin, it wasn't a big enough group of individuals that they were using the vitamin C on. Like maybe there were a couple of people that were using high dose vitamin C, but we really haven't had enough data to kind of like recommend for or against. And as far as in the ICU, if it's not really causing that much harm, we're like okay with utilizing certain things or trying certain things out. I just feel that like I said, we just need a lot more data, a lot more people to kind of like try these things on before we could come out with actual recommendations or the next steps that we should be going towards. You even hear about certain anecdotal things where people are utilizing glutathione and trying to decrease, respiratory complications and inflammatory sort of syndromes by using glutathione. So it's like we need bigger sample sizes, before we can make some of these recommendations.
Great. Well, Dr. Phillip, thank you so much for joining us today and sharing your expertise and experience. And like I said, you're an MD Fitness for Life on Instagram.
Yes.
And you can also reach out to Dr. Mike and myself, and we can get you that information, or get you connected with Dr. Phillip.
All right.
Anyways,
Dr. Brian Phillip, thanks so much again for coming on. You some great advice. Your words are cherished. Much appreciated. Thank you so much.
Thank you.
Thank you, guys. Thank you, everyone, for participating tonight, and we'll see you guys soon.
Take care, guys.
Good night.